Morning. Hi. Okay, here we go. A patient receiving mannitol shows which sign if the medication is effective. I don't think stretch was an option, but we'll go with that. Stretching. Decreased urine output, improved LOC, bradycardia, or fever. It is improved LOC.
Good morning.
Yeah, it would be good morning for them. Okay. Which finding is associated with a basilar skull fracture? Paralysis, hyperreflexia, I hate these words. Diplopia, or Battle's sign?
Good morning.
You're right, it is Battle's sign. You're so smart, Argyle. Okay, why is coughing concerning for patients who have ICP? Causes hypoxia, decreases blood pressure, increases ICP, or causes bradycardia?
Good morning.
You're right, it is that it increases ICP.